All right, folks, good evening. I'm Leonard Howard. I'm the fire chief here in Brattleboro. To my left here is Assistant Chief Keir, and over to the right is our town manager. First off, I want to thank you all for attending tonight, as this is an important topic to all of you, as well as it is to us. I would first off like to thank Rescue for their 56 years of dedicated service that they provided to the town of Brattleboro, as well as we look forward to the next few months as they finish out their contract. And I'm hopeful that we will work with each other under a mutual aid agreement in the future as we need to. The reason we're here tonight, the town administration on March 25th received a letter from Rescue Inc. advising the town manager and the chair of the board that Rescue would no longer be providing EMS service to the town of Brattleboro starting July 1st. So as the fire chief, it is my duties to make sure the people of Brattleboro are provided with the same level of service they've gotten for the last 56 years. And this meeting and presentation that we're going to do tonight is I'll show you that we'll keep that level of service, and I honestly believe it'll be better. Patrick. Yes, at the end, there'll be questions, and we ask that you go up to the podium here because there's a microphone, so the folks on TV and on the web can hear you as well. This is just a list of our staffing. You can go ahead and forward along. About the change, what you'll get and what you get now, we've been providing EMS service in the town of Brattleboro since 2000. When you call 911 now and say you're having a heart attack, stroke, chest pain, a fire truck shows up as well as an ambulance shows up. Majority of the time, the fire truck shows up first. And dual trained staff is our folks are trained in fire, EMS, technical rescue, hazmat. That's what we mean by dual trained. They can handle just about any situation that they encounter. If they can't, they know where to get the resources. They know where to get the resources to. Again, I'll talk about level of care. As I said, I feel our level of care is equivalent to what you're receiving now, as we've done it since 2000. And we'll continue to do it for many, many years, as long as we're here. So level of care. Continued care from the scene to the hospital. As I said, since 2000, we have been going to life-threatening emergency medical calls. So this staff, it's not something new to them. They've been dealing with it. They're trained in it. So now, like I said, typically the fire truck and the ambulance shows up. Depending on in town, we show up first most of the time. Our people get off the truck. They go up to the patient, start talking to the patient to see what their medical issue is. They'll start evaluating that patient to see what that patient needs. And then at that point, the ambulance crew arrives. And typically what happens is we tell them what we've found and done at this point. And in turn, then they'll turn around and start asking the patient same questions that we asked them. But the model that we're going to have moving forward July 1st is it's going to be one continuous thing. Fire department's going to show up. They're going to start asking you the questions. They're going to see what you need for care. They're going to start providing that care and then get you into the ambulance, take you to the hospital, and then that's when we'll transfer care to the people at BMH. There won't be two times that care gets transferred. Transferring care a lot is where mistakes happen. I'm not saying mistakes have happened at all, but that's when mistakes happen, is a transfer of care. So if we're doing it once instead of twice, it's much better for you, the patient. Fire-based EMS model is the most efficient and effective standard practice for rapid delivery of medical care. It's just the International Association of Fire Chiefs is very vocal about that. That's where I got that statement from. And I honestly feel it is the best care that you can receive. The financial platform, and again, I've stated this in the paper, on TV, it's nothing, the financial part of it, the fire department doesn't care about that. The fire department cares about the level of care that you folks receive. And that's what our mission is, and that's what we do every day. So later on, I'm sure you'll have questions, and you can ask the town manager on what the revenue will be used for. But I just put a couple things in there for you folks to see. And again, this is our motto. It's our town, our people, our responsibility. And these gentlemen and women that are standing in the back here, they live by that every day. And that's just the mindset that we have. BFD, current EMS staffing levels. Currently, we have 18 medical technicians, 6 advanced emergency technicians, 2 paramedics, 1 that's a paramedic now, and another that's he's finishing up his clinical time and ride time right now. So by July 1st, when we go into service, he's gonna be ready to go. Recently, March 29th, we had 7 of the 18 EMTs enroll in an AEMT class. They will finish that class at the beginning of July, and then they will be advanced EMTs. So our advanced EMTs will be going up to 13. And then with a model, we'll be sending 3 more of our members to paramedic school in August, which once they complete that, that'll bring us up to 5 paramedics. I know there's been some questions out there in the news and on social media, and one of them was, why you folks don't have ACLS? I'm gonna have Assistant Chief Keir explain what ACLS is and what we need to do and how we do it.
So there's 2 questions that we oftentimes see. One is we don't have ACLS, Advanced Cardiovascular Life Support paramedics. Actually, every paramedic in the state has to go through an ACLS course. So that's a pretty common thing to have. The other common misconception that we hear is critical care paramedics. There's 2 different types of paramedics. A paramedic that is used for interfacility transport typically is a critical care paramedic. A paramedic that responds in the emergency field or to 911 calls is a paramedic. The difference between those 2 and what they can do in an actual emergency is very limited. Those things can range from ultrasounds to other things, but in our particular case, with a short transport time, critical care paramedic wouldn't be something that we would utilize hardly at all, if at all. So that's the critical paramedic and the paramedic, along with the ACLS.
Can you just explain how our staff's going to do Q&I, critical care oversight?
Sure. Q&I, we have currently an MOU signed with Brattleboro Memorial Hospital for clinical time. So what that means is that all of our staff members, from paramedics to advanced EMTs to EMTs, will go to BMH. They'll work at BMH emergency room, lab department, utilizing their skills, gaining their skills that they have or that are part of their protocol set. To better those. We also have a contract with Dr. Storn and Dr. Swosey, who are the medical advisors for District 13, and they will review our calls, QA/QI, along with provide training as needed.
Those 2 folks will also see our preceptor policy for paramedics, new paramedics. They'll oversee that they meet the requirements before they're put out into the field.
I'm sorry, but some people may not be familiar with the abbreviation QA and QI.
Quality assurance, question and answers. Those are things, so they'll critique our calls, they'll review our calls, they'll read our narratives, they'll look at the clinical decisions that were made on scene, and then feed back to us errors, support, things that went well, things that didn't go well, that type of thing.
And they do that currently now. Okay. The 1-year transitional model is we're calling it an apprenticeship program between BFD and Golden Cross. It allows for our members to be trained on transport protocols and procedures. It allows us to purchase the equipment, including ambulances, that will be required to provide the transport service, and it allows our current and future paramedics working with experienced providers from Golden Cross, as well as through the program that we've established and signed a contract with VMH.
Golden Cross, so paramedics.
Golden Cross, their goal is to have a paramedic here 24/7. And then we're gonna have a second provider from 8 a.m. to 8 p.m. because that's our busy call period. A lot of questions is, well, you're gonna have to add staffing and all this and that. You're right, we're gonna, the proposal is to add three firefighters, one to each shift. We're gonna apply through FEMA, a SAFER grant, which if we're awarded that successfully, they pay for those 4 positions for 4 years. So the town won't have to absorb that cost until the 4 years is up for that grant. Okay. Again, I mentioned earlier that we're partnering with Golden Cross for that year. During that 1-year layout, they'll have 2 ambulances at Brattleboro Fire Department Central Station with additional provider coverage during high volume hours. And their motto is quality care begins with preparation. And this is a family-run business, and they've been in business since 1962. And I would like to introduce Dale and Lynn Gerard, who are the owners of Golden Cross, and have them come up and say a few words.
Thank you, Chief. I'd like to start off by thanking the town for the opportunity to come down and be able to work with the Brattleboro Fire Department. We have actually used this model before. We were up in Littleton, New Hampshire, approximately 4 or 5 years ago at this point. We work very closely with Littleton as they work their way towards getting into the EMS fire-based service, which they are doing a great job up there. They went on their own, like I said, I think about 2 years ago at this point, but we spent almost 2 years up there. Originally, we went in, it was like 6 months, and then it was a year. We kind of dragged along, just trying to make sure that they were well prepared before they went off onto their own. I have owned the business since 1999. It's been in the family since 1978. We've been at the paramedic level, both in New Hampshire and Vermont, for I'm going to say approximately 30 years at this point. So we ended up with our first paramedics, I believe, right around 1990, and started running the protocols at the paramedic level at that point. We have, I believe, and again, I apologize for not remembering the exact number of towns. I believe we have approximately 15 towns. Again, I know I sent the chief the list of towns that we do cover. We cover both out of Claremont and Westminster, Vermont at this point. Anything else you can think of?
No, folks may have questions as we end the presentation. Thank you. This chart here shows, if you'll see, the orange calls are actual fires, the blue calls are medical emergencies, and the gray calls, the gray is all the other calls that we go to as far as fire alarm activations, car fires, brush fires, chimney fires. That's in the gray area. I just wanted to show you the 8 a.m. to 8 p.m. As you can see, the blue, that is our busy time for the medical calls that we currently go on. That is our busy time period. And that's how we came up with having that second provider from 8 a.m. to 8 p.m. This orange shows that this is for 2021, the structure fires that we had. It shows that we had 11 last year. I put it up there so you could see the time of day that it happens. Obviously, busiest time of is last year was between 5 and 6 p.m. We had 2 on those 2 times, but and I know it's a big question. People said, "What are you going to do when there's a structure fire?" Well, as you can see, fortunately, because of fire prevention and fire education, our number of fires are down, and that's good. If we're not going to fires, that's a good thing. So, and we're showing that, and I just wanted you folks to feel comfortable with that. Why is fire-based EMS important? Well, we have 2 stations geographically located, allowing us to arrive to the emergencies quickly. like I said, majority of the time we do arrive first. The 2 times that we typically don't is when it's right on the south end near rescue quarters. And then on the very north end of town, because rescue can hop on the interstate and go up the interstate and we go through town. It's the couple times that they arrive ahead of us. And again, this model will allow for 2 ambulances to respond to emergencies while utilizing our 2 other fire trucks apparatus to still run as first response. So if the 2 ambulances are tied up on a call, you're still going to get a fire truck there to the 3rd and 4th call to attend to you. And one will either, with the short transport times, because we're only serving Brattleboro, those other 2 ambulances are going to be freed up quickly. If they're not, we'll call a mutual aid ambulance. And our hope is our relationship with rescue stays with the mutual aid, and they'll be responding from their quarters in town. And again, BFD makes patient contact, recognizes the treatment plan, starts implementing the plan by obtaining vital signs, patient history, IV access, does a 12-lead EKG, and administers the medications that they've determined they need to. And again, the big thing is transport. The only time patient care is turned over is from when we arrive at BMH and turn it over to BMH. Mutual aid system and how it works. We have a mutual aid system for when we have fires in the town, that once we strike a second alarm, we automatically start. It's automatically started if these other towns start coming in to provide service for Brattleboro, to back us up. They cover our stations. Those people are going to show up with cross-trained people in fire and EMS that can handle your situation when it arises. And again, we'll do the same thing on the medical emergency side, as we already have it in place for what we call mass casualty incidents, where we have a large amount of people that have been injured from a car going into a crowd of people, or so on and so forth. We already have this all established. And again, you can see our first one on top, as long as they're willing to do it, to help provide us mutual aid as rescue. This slide shows that this model that we're sharing with you tonight is not something Brattleboro's invented. It's done locally, statewide, nationally, and these are the departments around us that are doing it. Burlington, South Burlington, Williston, Springfield, Montpelier, Berry City, Hartford, Windsor, and then our neighbors, Keene, New Hampshire, Swansea, Peterborough, Greenfield, Turners Falls, Orange, Mass, Northampton, Mass, and Athol, Mass. Those are just a few that I can tell you. So it's nothing that we're reinventing. It's been done, and it's been being done for over 50 years. So we're not reinventing something new. And as well as we've been doing it since 2000. International Association of Fire Chiefs based emergency services position is fire service EMS is the most efficient, effective model for rapid delivery of emergency medical services. When time is critical and effective pre-hospital care is necessary, the fire service is well positioned strategically, geographically, administratively, financially, and operationally. Therefore, the International Association of Fire Chiefs urges all elected and government-appointed officials, professional associates, and healthcare providers to recognize and support the provision of emergency medical care, first response, and ambulance transport by the fire service. Currently, right now, Rescue provides service to 15 towns and covers 500 square miles. Figure that out. That's a big area for 9 ambulances. Under our proposal, we're going to cover 12,000 people, 32 square miles with 2 ambulances and 2 fire trucks that run first response. So I think our comparison and our model is very accurate, and it's going to provide you folks with a level of care that you've been receiving right along for 56 years. And as I stated before, I think the service is even going to be better. That's my presentation on it. We will now take questions from the folks in the crowd and on Zoom. And the folks in the room, if you could come up to the podium so the folks on Zoom can hear you when you ask your questions. Thank you.
I'm Kate O'Connor, and I'm from Brattleboro, and I want to say to the fire department, thanks for hosting us. I love the men and women of the Brattleboro Fire Department, so thank you so much. I guess I have two questions. One, how long has the town been talking to Golden Cross about this contract? And two, right now from Rescue, we can do subscriptions, you know, like a person or a family or household can get a subscription. I'm just wondering if for the next year, is Golden Cross going to be doing that same thing? So thank you.
First question is, as I stated in the presentation, Yoshi called me March 25th and says as of July 1st, we're not going to have Rescue providing EMS coverage. My job was to figure out how we're going to do it. So I called Dale. So Dale, this is what we're in. Can you help? Within 10 minutes, he said, I'll help you, do whatever you need. Told him we're looking at maybe a year, could be 2 years. It depends on how long we have to get ramped up with ambulances and stuff. And he was on board. So that's how soon I've been talking to Golden Cross. As far as the subscription plan, we're not gonna do that. I would ask you folks, maybe reach out to Rescue and say, hey, can I get a little bit of refund on my subscription plan? And again, just so you understand the subscription plan, you get a free ride, but the other thing is your insurance is still getting billed and they're getting money from your insurance. So it's not like you're just getting it for $50. Your insurance is actually getting billed for that service still.
My name is Bob Murray. I'm a taxpayer. Nothing fancy, just a taxpayer. And I guess I got two questions. One is what is it going to cost us for Golden Cross?
$75,000.
Say that again.
$75,000.
That's what I thought you said. Okay. And is Rescue agreeable to the mutual aid business?
That, we
Excuse
haven't
me.
sat down and had that conversation with them yet.
So
Certainly hoping to sit down and.
So if they don't, what's the plan?
The plan is to call the next mutual aid ambulance, which could be Keene,
Okay.
Northfield, Greenfield, Mass,
Okay.
Deerfield Valley. But let me just say this, occasionally our staff arrives on scene and rescues units are all tied up down here. We've sat on scene and waited for an ambulance to come from their West Townsend station. So it's not something that
Yeah. Okay.
that's never happened.
All right. Well, that was. I know that there was a price of what Rescue give for coverage, and I just wondered what the difference was in the price.
The line item in the budget for ambulance service is $286,300.
Yeah, that's what it says in the paperwork.
Yep, and they're charging us $75,000.
Okay. Thank you.
You're welcome.
Yep.
Take my mask off.
Sure.
So I'm Heidi Fisher. I'm a Brattleboro resident. And, sorry. I honestly have no agenda about which way we go. Fire EMS is a great way of doing it. I've seen it work wonderfully. I also was a volunteer for Rescue for 10 years and was on Rescue's board for 5 years. And I'm also currently an RN in the ER. So I'm on the receiving end of ambulances all the time from various different services. So I have some knowledge of how all of this works. When I was on the board of Rescue, the town had looked into multiple times, or actually twice, I think, while I was on the board, how this would work and if the town could take over doing exactly this. And came out both times very, very clearly that financially it made absolutely no sense for the town, that what Rescue charged was far more reasonable than what the town expenses would have to take on to be able to do this. I know that's not your answer to the question, it's more the town manager answer to the question. So I wonder what's changed and why all of a sudden it seems more reasonable for Brattleboro to do that. So that's one of my questions. And I honestly wonder whether the town is being realistic about what it really costs to run a top-level ambulance service like Rescue. I don't doubt that Brat Fire, and I know a lot of these guys, and I've been on scenes with them, and I've gotten their reports in the ER. So I don't question that they're perfectly capable of doing it, but I really question whether the town knows what they're getting into, because EMS is a complicated, very expensive, not money-making affair, in my experience on the Board of Rescue, and et cetera. So that's one of my questions. And then I have a lot of little questions about how things would work in terms of mutual aid is a big concern, even though, yes, I know you can wait on scene till Rescue can get there from Division 2. Keene is a far way away in bad weather to get over Route 9 to answer a call. Response time seems like they could be incredibly long, and I've seen really bad results of incredibly long response times as a medical professional. So I'm just looking to see what my other questions were here, if anything. And I also just wonder whether, when I know what it takes to cover 24/7 coverage, I wonder whether 5 medics is really going to be able to do that 24/7, 365 days a year. But so I have some staffing questions too. But my main question is for the town. I'm not wedded to either style. I just wonder if the town could speak to what it's going to be for the town.
So, it's my experience. I'm a town manager of Yoshi, if some of you may know me or may not. So this is the 3rd municipality that I've worked for. And the other 2 places, we had a fire EMS. This is in Bloomfield, New Jersey, which is about 5 times the size of Brattleboro. And then I was just in Trenton, New Jersey, which is about 10 times the size of Brattleboro. And which was a unique model, which was a fire department. Then we had a nonprofit EMS, right? So it's as if Rescue was reporting to the fire department. So it was a very different model, but it was because of the amount of volume of calls that was happening in Trenton, and obviously the type of calls, right? Where Trenton happens to have a lot of gunshot victims and some others. So you need to have that full-time professional EMS specialty there. So you can imagine the cost was very high. Also in Trenton, they have about 40% of uncollected, which is incredibly, I don't know if some of you know, and you probably know as who's on the board, that is a very, very high number. And that's because we have a lot of people in Trenton that didn't have service, or they didn't have insurance. They weren't covered by Medicaid, they weren't covered by Medicare. We had a lot of undocumented people being serviced by that fire department. So that model is what I looked at. And so I handled that budget. I was the deputy mayor, and I oversaw that. And in that town, the amount of the money that we had to offset their expenses was $65,000. So for a volume of number of money, the amount of money that was coming down with the number of uncollected that was coming in. So when I saw this budget of 285, this is purely, that's the thing. And then also when I spoke to, had my department head meetings, and one of the things they had brought up, which I know the fire department has been talking about this for about 20 years now, right? Like you said, they had brought this up multiple times.
We've done it in 2008 and 2001.
It's my job, right, is to say, okay, let me think about this. Like, what is going on here? Why is this not making sense to me, where as a city that is much, much larger, with more volume, with a lot less collected, is paying this amount, and yet Brattleboro is paying this amount? And so my question, and is what we had that initial meeting is I need to have that information. I need that data to support, to tell me what's going on. Where is the formula being, put together? Is this because of the regional, or is it because of just Brattleboro? Does Brattleboro have a high, uncollected that I'm not aware of? that's information that I think is really important for as taxpayers and us that we didn't know. And so that's something that I was doing my research on. And so then I looked at some of the local other towns, so a lot of the other towns that Golden Cross covers, they're a similar size, right, to Brattleboro, and they were paying at a much lower cost. So I said, it can't be a Vermont thing, right? There must be something else to it. And so that's what I've always been asking, right, is that we've been looking for is just that information. Because we need to justify things. And I think no matter who you are, right, whatever contract it is, no matter how long they are, we didn't know how much and why. And so that's something that I was really looking forward to and trying to get that information. And you know, I did what I could to find on publicly available and, you know, the tax forms and the other issues I can look at. And noticing based on what I understand of how not the algorithm, but the assessment is done, is basically based on uncollected amounts. And then the reporting on there, which was about 19%, which is uncollected, that was what was reported in the IRS, so I'm assuming that's the number, right? But that's what I looked at, I was reported by Rescue to the IRS, is 19% uncollected. So, okay, I'm like, okay, well then that means this is our number, and this is the total number that Brattleboro is possibly getting. Now I lowered the number, I tried to, you know, adjust it to be very conservative, and still that number came out to a fairly large number if you add in the assessment of the town. So again, this is a full assessment. This is what I'm hired to do. This is my job, right? This is what I'm a professional to do, so do the analysis. I didn't go in this being, you know, for fire or for any other reason, but trying to understand the numbers, right? And when I was presented to them, I asked Lenny, okay, what is the pure cost? And that's something, right, that we need to know more of. Mm-hmm. And that's something that we were really looking for. And actually, one of the things that we are going to do anyway, which we had planned to do regardless, is to find a third party, like a consultant. There was money in the budget this year, about $25,000, that I've asked them even before, you know, right after that meeting, I was like, look, I'm looking at numbers and I'm seeing this large amount of money sitting here, but I can't be the only one to make that analysis. We need to have another party to do this. So what we did is we found a couple of companies that said, get me some bids, right? Find me what are the costs of being able to do that? So we have those. It's going to take about 3 months. We're going to do it anyway. Like regardless of what happens, we have to do that analysis, right? Because you cannot ignore that amount of money that's possibly sitting there. If I'm wrong, then I will fully, you know, own up to it, right? It's like, that means I made a mistake somewhere in my analysis. But that's why it's important for us. But I've checked it over and over. And I believe that I'm correct, but let's have that third party do that analysis too. And they're not only going to analyze the numbers to make sure the numbers are correct, because we're hearing from other towns and others. We talked to other fire EMSs and talked about the revenue. And they are getting large amounts of money as revenue. So it's not like it's costing, but we've talked to Northampton. They received about $2.5 million last year. So these are places that are substantially getting a large revenue source, and we're just trying to figure out why, right? So we need to know what the cost is. We need to know what the transition is. I need to know, even though I trust our chief here when he thinks it's a cost, I need a third party to say what is the true cost, right? Because that will give us a better understanding. I have to remind people, the select board has not decided to do fire EMS yet. They have not said they will, right? What we're trying to do is a transition to understand the issue, because that's the most important part of it right now, is really understanding, can this something that's feasible? We're going to do this study to make sure that it's feasible. We're going to understand it. And then, you know, we have to have a plan anyway, because right now that's the situation, right? We needed July 1st, we needed to have EMS services for the town. And if that service comes back, or that, you know, analysis comes back and says, you know what, this is not a viable solution, right? Not financially viable, then it's important for us to go out to bid, right? That's something that I'm very much believing in transparency. It doesn't matter who you are, 50 years, something. Contracts are supposed to be going out to bid. You're not supposed to just give it to somebody. You have to give an opportunity. If you give it to somebody at the same time every year, that's wonderful, but they should be giving it at the cost that's competitive. Because Brattleboro is Brattleboro's, right? That's the contract. Every other town negotiates themselves, right? In this case, this is what Brattleboro needs to negotiate. And so in this point is what I tried to make clear, is that we'll then go out there. If it doesn't make sense, we'll go out to bid. If ultimately, because you know how it usually works, you don't have to choose just a lowest possible bidder. If it's because of the relationships or because of the level of service, we'll factor that in. If that comes down to a year from now, we ultimately have to make that decision. And if rescue comes back, then rescue comes back. But I think that's what I just want to make sure on the numbers. That's really important for, especially as town managers, to do that analysis. Oh, but you have the second question. You want to, or you already asked
So
it, right?
I'll do my best to answer the second question. If I remember right, you talked about the 5 paramedics on duty. So our statistics really show that with our 5 paramedics on duty, covering the 32 square miles, that will be able to satisfy that need within the Brattleboro town. We're not talking about 15 other communities. The idea behind the 3 paramedics is that we will have 1 paramedic on duty 24/7 available for calls dedicated to Brattleboro. The additional paramedics represent somebody on vacation or somebody out sick, and having double stack on those times when somebody's not on vacation or somebody's not out sick. And then we also have that strong contingent of those other ALS providers and advanced EMTs.
Just so folks know, of the 1,367 medical calls we went on last year, 6% of them required a paramedic.
Dora Bubalis, Brattleboro. I am one of the people who was on the select board when the town looked at that. Barb Sondag, the town manager, John Leisenring, the finance director, the fire department, rescue, a public committee, because that's one thing that you've left out of the whole process here is the public, democracy. Very disappointed in the select board on this. We found it was at best a wash, and at worst, we would lose money on it. I'm hearing $286,000, and I'm hearing you compare it to what other costs are, but I'm seeing $286,000, and I'm saying that is below what it would cost us for salaries and benefits for extra personnel. So then you factor in getting ambulances, and you factor in the equipment and all the other stuff. And personally, I think you need a minimum of 4 ambulances. I don't think 2 is in any way going to cover it. If you're going to have the stuff, you got to have it. So I'm glad to see that you're doing a study, but everything's backwards here. The study should come first. Public input comes first. There should be a committee. All of those things need to happen, and I haven't heard any of that. So, and I understand where the fire department is coming from, because they did receive a letter, and now they have to figure out what to do. So, that's where we are. But I want to know what happened prior to that as to what, and I'll ask that at the select board meeting tomorrow. So the other question I have is, how comparable are salaries and benefits with Golden Cross to rescue and the fire department?
I can ask your question about like revenue, right? We're just basing it off what we know is the IRS reports, right? Because that's all we had provided to us. Was we had asked for the actual billables, and unfortunately we weren't able to get that. So we had to go with what was publicly available to us. And based on that, so if we charge the same amount per call per service, which happens to be one of the highest in the state, unfortunately, it's approximately $1.1 to $1.5 million. That's the total cost that comes into as revenue, right? So fire department is doing this, is not going to be doing it for free, right? They're going to still charge for Medicaid and Medicare, which is a capped amount, right? You'll still be charging its private insurances. You'll still be charged. These charges are still going to happen. That revenue now instead going to rescue or Golden Cross, or you'll be going to the fire department. And that's a substantial amount of money. Even if you double the amount that we estimated it is, and if you added the third or fourth, cost for adding it, it's still much less than the $1.2 million to cover. Because again, we don't have to cover insurance costs. We don't have, well, not substantially. It's a slight increase. We've talked to our provider, because insurance, the state insurance already is covering a lot of the other state fire EMSs. Most of our personnel are already joint, so you already have personnel, so you don't have to have another 20 people. You're adding 3 new people. If we added more than that, it's still not a substantial cost. If you added some of the equipment, we have we have a building already, right? We already have buildings. We don't have to pay for buildings. We
have the equipment. The only equipment that we need is for our paramedic staff And as you know, we're in the process of getting our paramedic license. Once we receive that paramedic license, we look at, that's about $7,000 of stuff that we have to buy so the paramedics can work at the paramedic level.
And also, I think this is maybe one of the bigger differences, and you probably know better than us, is that in 2018, there was a substantial change in reimbursement rate. I think prior to that, there was a lot of struggles. I think that was an issue that was around the country about the reimbursements and how, a lot of EMS, just private EMSs, were struggling during that period of time to cover services, exactly what you're talking about. I think that changed. I'm not an expert in Medicaid, Medicare, and those, that's about 60% of most calls is about those two. Those substantially increased in about 2018. And I'm not an expert in those fields. I just know that that's what changed, and that it made it more financially viable to be able to offer a lot of these services. That in the past, when you guys did the study, was a very, very different landscape. Right? I think that was about 10 years ago, or so, right? So I think that's one of the main things that are driving there. But again, I think that's important, why we have to ask this third party to be able to do that full analysis. And if it comes back exactly what you're saying, this is not what happened, then absolutely, I think that's something to look at.
As far as your comment about 2 ambulances not being enough, Burlington, very large city, their fire department runs the fire-based EMS. Up until just last year, they had 2 ambulances to cover the city of Burlington. They just added a 3rd one. So I'm fairly comfortable with 2 ambulances for Brattleboro.
You didn't address the democracy portion of that, though, the fact that a lot of citizens are blindsided.
So what we did is approached Rescue to provide us information. And that's what we thought was the beginning of negotiations. That's honestly where we were. And the next correspondence we got was to let us know that they weren't going to be providing us service anymore. And that's where we had to all of a sudden, because what it is, it's July 1st, there is a certification level that takes 2 months, right? And so we now all of a sudden had to find a provider for July 1st within a very short period of time. So we were limited in what our options were. We either went through another contract with Rescue at what they had asked us for, which is a 3-year contract at the full $286,000, which was offered to us, which, our select board was still doing like what they want to do. They were trying to understand can you do it? How long is it going to take? We were trying to do this sort of an internal sort of figuring out, it's a contract negotiation, right? I don't think we had ever thought that we weren't going to be working with Rescue. That was never as part of the conversation until we received the letter.
The initial conversation is to do the analysis and offer Rescue a 1-year contract during that analysis to basically do what we're going to do now. And as the town manager stated, we got the letter that they were ending service July 1st.
By the way, I think you should go up to the stage so that the people online can hear you if you are going to ask a question.
Pat Green, I'm a resident native of Brattleboro, and I thank you for this meeting because I've been going back and forth with email to some of the select board members. And I want to thank the fire department. In the past year, I don't know how many times we've had to call 911, because I'm right next door, so these guys come over with their satchels they don't need. And I was, of course, worried more about the paramedics, and because sometimes they spend 10 minutes in your yard in the ambulance getting ready to transport. It is $1,000 just to get into rescue, and that's not counting per mile. So to BMH from here is like $1,025. I'm not slamming Rescue because they were absolutely good to us, as was the fire department. And I did lose my husband, but he was a very sick man, but they did the best. And I asked, when I was emailing the select board, one select board member came and mentioned transport. So I know these two won't be able to transport. So a mutual aid or Rescue would probably do the transporting to either Bay State or Dartmouth.
The transfers, yes.
Right, so-
When you go to the hospital and the level of care that you need can't be provided at BMH, you'll be transferred to, say, Bay State in Springfield, Mass. Rescue will still do those transfers.
Okay, that, because I was so vehement when I read this, oh my goodness. So I'm so glad, again, thank you so much for the meeting, and thank you for all you have done.
Chief, how are you?
Good to be here. Thanks for having the meeting, Yoshi. Thanks for being here. My name is Jim, Jim Nicholson. I'm a citizen of Brattleboro, and I work in EMS down in Greenfield. My question is really more for Golden Cross, since this is going to be an added burden on you guys. I'm familiar with kind of the burden that EMS is under right now. It's pretty substantial. I do recognize that Brattleboro won't be doing those transfers, so that's a good thing because they're going to be in town, available for calls. But I'm assuming Golden Cross's role is going to be transport, correct?
That's correct.
Right. So, are you prepared to absorb that added burden on your system with additional investment, staffing, all that's going to come with, taking on this project?
So I guess, yes, we're prepared to, from a vehicle standpoint. I have approximately 17 ambulances currently that, again, we have a lot of backup type of trucks when I'm using that for a number.
And they're all licensed at the paramedic level as well?
In both New Hampshire and Vermont.
Yep.
It's as far as staffing goes, as you said, we're all, every EMS agency across the country is seeing the same thing, which is why we've been speaking very closely with the chief and the deputy as well, because we want to make sure that this is a win-win situation. I'm an active paramedic myself still at this point. Not that I want to be here 24/7 for the next year by any means, but I will make sure that the coverage is what is being asked for and required to make sure we fulfill the agreement with the town of Brattleboro.
And as far as equipment goes, are you going to need to make those additional investments?
Honestly, I got Life Pack 15s that are fully loaded sitting on the shelf in the office because over the years with upgrades, I end up purchasing stuff, and then Physio come in and offered to upgrade some of our older equipment. So I've got a lot of spare equipment sitting there ready to go that it's all been recertified by the companies as well. So.
Great, thank you.
We're also looking to hire. So if anybody, Jim, if you're a fit into the family, call us. Someone had asked about wages. Okay, so we start at 15 with our EMTs, but our goal is to increase them as quickly as we can. A lot of, if someone works a 40-hour work week and they pick up more shifts, that 8 hours is now at time and a half. Paramedics can go anywhere from 23 to on up, depending on their level of experience. So truly, if anybody is interested and would be a good fit at the station and with Golden Cross, we'd love to hear from you. Benefits. I love to talk about benefits. We actually offer a retirement plan for folks, a 401k. If we're only here a year, your folks will only have about a year. They have to have a year to get vested. If we're here for 2 years, then. So we offer a match, which is pretty exciting. We have vacations, 2 weeks paid vacation. We have 4 paid holidays, disability insurance, medical insurance, and we have Blue Cross Blue Shield Pathways Plan. Your hospital is part of the network. We also offer a plan that's outside of the network, but of course it's a lot more expensive. Dale and I supplement the insurance by 75% approximately. This is our life, and we want to make money, but we're not out to make a killing. What's most important is providing a good service and good care to people. So, are there any other benefit questions? Did I miss anything? Okay.
I apologize for coming up twice. And this question is, I'm having to come up because of what the town manager just said. And I need to set it straight while everybody's here, that there's this narrative that's coming out that Rescue sent a letter on March 25th and said, we're done. What's being left out, and I'm going to read the bottom of it right here. It says, this is to our town manager from Drew Hazelton, the chief at Rescue. It says, if the town would like to come and speak with me about an agreement for service beyond June 30th, 2020, please contact me no later than May 1st, 2022, to schedule a meeting. So it's a false narrative. It's not your fault. I'm not talking to you folks. I'm talking to the town, that there's this false narrative that the town is perpetuating that Rescue will not negotiate. And secondly, I'm going to look at the select board on this one as well. Twice people have asked about where does the public come into this process. I love the fire departments. This is nothing about you folks. But that question still has not been answered about where does the public come in. And I didn't mean to bring this up tonight. I was going to bring it up at the select board meeting, but I can't let it go unsaid at this meeting. So thank you.
Hi, I'm Beth Kendall, and I'm also a resident of Brattleboro, and it's nice to meet you. And thank you for your presentation, because I am also a medical professional, and a lot of this is important to me. Just two quick things. Number one, and thank you, Kate, because I think part of the issue, and this is is transparency, and there's some history to this. There has to be. I certainly don't know what it is. My experience with Rescue is only one of a patient that got incredible treatment, and working with the fire department a lot at the retreat, and I get all that, but I do think that it's important for our town to understand really the history of this whole conversation. You talk about the most recent, Yoshi, and I appreciate that, but there's obviously more. That's one. The other is, I'm curious about coverage in relation to what Rescue offered for us. Now, I know it's hard to actually determine that because it's a much larger area that they're covering. But when we talk about X number of paramedics on X number of hours, blah, 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 at some point, it's just be good to understand how it compares to what we've gotten, if there's a way of comparing it. Thanks.
I forgot one more financial question, and that is that my history on the select board and history in union negotiations tells me that union leadership is already talking about what minimum manning is going to look like with this new system. So if we think we're going to get away with minimal staff, our history tells us that that's probably not the case. So we need to know what that looks like, and you got to bring the union in on this. That's part of the whole public process.
Yes, I think you're absolutely right. I think that's talking to the union is an important part of it, and that's where the 3 new firefighters came from. That was a discussion, very top-level discussion with them and asking them about what is that comfortability. We wanted to be preemptive about that, so we did talk to them about that. So that's why there would be additional 3.
Any on the Zoom, Patrick?
You might ask if anybody who is in the Zoom meeting would like to ask them to
Folks,
raise their
if you
hand.
got questions on the Zoom, please raise your hand and Patrick will call on you.
Not yet, sir. Oh, here, there is one. Millicent Cooley.
No, hold on, there's
Yeah, I just wanted to follow up again, that, somebody did question you about like the end of the letter saying contact me, or can you speak to any communication of that sort that you've had?
No, what we have here is that so part of their contract with the town, which, says that you have to provide notice, right? A notice of either the town or rescue has an option to be able to inform the town within 60 days. I think it's the 60 days, I believe, in the contract, prior to the contract being complete, that you will no longer provide service. This letter, we took that as that kind of letter because it says Rescue Inc. will not be able to continue providing that service to the town of Brattleboro beyond the June 30th, 2022 contract end date. And yes, after that, it says if the town would like to come back and speak. But what we took that as is you ended the contract, but if you would like to have another contract afterward, please come to us, right? But the contract was completed with us. And so then and especially, we're also losing sight of the 3 paragraphs before that that accused the fire department of a number of accusations that it was difficult for us to be able to read and to understand how that was coming about, especially in this. And also talking about our paramedics license, that was a completely separate from our contract negotiation. So you can understand this letter was not just that last paragraph and last wording. It also had 2 or 3 other paragraphs prior to that, which we felt we were not sure what was the point of those paragraphs when it came down to the contract negotiation, because that wasn't part of the contract negotiation.
Have there been any conversations since?
No, we took this around the world, and we had to make an effort because we had to get on. We had the 2 months notice, right? All of a sudden, we had 3 weeks to find another provider and to come up. Can we even find another provider?
We had to do something because you have to have 60 days. When Dale applies for what he's already applied for his license to practice down here through the state, you have to.
Each region has a different license.
You have to post a public notice in the paper, and it's allowed 30 days for folks to comment on it. So there's certain times that you have to, you just can't all of a sudden June 29th say, okay, we're gonna call Golden Cross and have them down.
Basically, you asked for insight into the charge and how that was divided out and why it was.
Sure.
And you were stonewalled, and then you got a letter that said they ended service and included some rather hurtful and salacious things. So you used that as an opportunity to create a year of investigation. This enabled an opportunity for.
Well, it was a different type because I think that what we had always wanted to investigate the issue, right? It's important to investigate. Exactly. We need to have it more public, to have this conversation. So I think that, I can't speak for the select board, so that's something to talk to them about. But we had been having that month, because we had in-depth discussions to say, they had to present, is this a feasible option? What do we want to do? I presented to them 4 options. We included a 3-year contract with, rescue. We can't just I can't just say, hey, this is it. Just like you're saying, this is a process. We had started the process, but we had a very limited time to do it because the contract was up. It's not just June 30th, right? It's 2 months prior to that. So really, we knew we had to get back to rescue with a offer, right? Either 3 years, 1 year, or sending us our own letter saying, thank you very much for your service, right? But we didn't get an opportunity to do that. We didn't get an opportunity to be able to provide that because we got this letter, which very much, again, none of us expected that letter, none of us. And it was very surprising to everybody, including the select board. And that was how it sort of changed to sort of like, what are we supposed to do now? Like now we're like scrambling because in this letter, it's pretty much telling us if, we either are stuck with nobody or we have to sign a 3-year contract with rescue. And that's really hard for a town to be able to put in that situation, right? Where you're told you either do one or another. And you can't do that to a town. Doesn't matter what contract or how long, no private entity should have that power, right? To be able to tell you. And that's something that I think that was very important for us, is that here we are trying to do what's best for the town and try to take a process, but now we're stuck with scrambling to try to find an option and thinking, that Golden Cross was willing to stand up for us. Because if Golden Cross wasn't available, you're absolutely right. You know what? We would have had to sign a contract. We'd have no choice. And I think that's because our fire department's not ready yet. You know, they're the first person to tell you they're not ready yet, right? Because they don't have that experience of the transfer yet. But what this has given them an opportunity, like exactly what you said, it gave them an opportunity to sort of say, okay, well now, if we have this opportunity, how would we want that relationship to work? This apprenticeship model, where he was, whereas a Longwood, you said, or Littleton, they're like, oh, well, we've done this before. They talked to our chief, and our chief said, okay, oh, maybe this model could work for us. Like, this is not something that we had been considering before, but okay, maybe this apprenticeship, this will give us the ability to build and sort of, ease into something than having going from, nothing to all of a sudden fire departments running it, right? Which I think that was something that even I was very uncomfortable with. I think I wanted to do it too. So absolutely, I think that it changed sort of the narrative.
Want me to stand up there?
I'm gonna help.
No, yeah, I guess I can make it.
Just letting you know, you got 3 in the queue.
Okay. Yep.
You already know who I am. And I have a statement, is that, as you know, and some people here know, I'm a 40-year veteran working for the town, and I retired. I'm hearing people saying, we got to go to the public, we got to do this. Well, I've watched in my 40 years, we've had studies on Main Street to get better. And then we've had public information. Then we had more study, and it's still there. I want to say that I think that we have elected officials, we have appointed officials, we have a town manager who's doing the job. And I think that that's a good thing. I think that that we, as a taxpayer, yeah, I've been here since dirt was formed, and I like to see these public heads doing their job. They are doing their job. They took the bull by the horn, if you will. Sorry, and they had to make a decision. They made a decision. Okay, as taxpayers, we pay. That's what we expect, or that's what we should expect. So I think that you all need to have a big round of applause, and I think that you've done one heck of a job, and I just wanted to say that.
Hi, can you hear me?
Yeah. Yes.
Thank you for letting me speak or ask a question. I don't have an opinion about whether Golden Cross or Rescue is better. I don't know enough. It's complicated. I have a question about why so much is about why Rescue may not be represented at this meeting. Golden Cross is being, I think I'm hearing it being presented as the alternative to Rescue. A lot is hinging on this letter that Rescue sent, but we're not hearing from Rescue about their reason for sending that letter or anything about it. So I feel that we're missing Rescue's point of view in this situation. And I'd like to know that. Is anybody from Rescue here? Were they invited?
It was a public meeting that was that's been on the town website, all our social media sites, our website, so they're certainly welcome to attend. My guess is you'll probably see them tomorrow night at the select board meeting, is my guess.
Okay. Thank you.
Okay, next person looks to be Caitlin.
Hi, my question is just what towns did you base your decision making on when you were looking for similar sized areas to make this decision? Which ones were they, and was it due to population or call volume?
It's a little bit of both, call volume and population. Hartford, Montpelier, South Burlington, Springfield, Vermont, all similar, very similar size. South Burlington's a little bigger. Springfield, Hartford, and Montpelier all show us that their annual revenue coming in is between $500,000 and $600,000 a year for their service.
Thank you.
You're welcome.
And the last person is Bob Oser.
Hello, good evening.
Hi, Bob.
How you doing?
Good.
This is a very complicated situation. I guess this may be a question for tomorrow night rather than for tonight. But let me phrase it this way: you've got a proposal out here, and you've got a relationship out here that seems to be promising. Is there another option? Or because of the way this is unfortunate, well, I shouldn't say unfortunately, but the way it's developed, is that your only option, or do you have other options to consider?
You mean other services, Bob?
Yeah, other variations. I mean, where I'm coming from is you do have a 56-year relationship that's ending somewhat abruptly. And one would think that the manner in which that ends is more important than when it ends or if it ends. And that relationship may also affect other towns. So while we are a town within a region, there are other towns that are related to us. And there may be unintentional consequences to how we decide things, even though it kind of looks good on the front end. And it is awfully complicated. So the question is, are there other options that you can consider, or are you kind of locked into this because of the way this situation developed?
I think that's more of a question for the select board. At the end of the day, our job is to provide options and opportunities, or that's our job, right? But the decision ultimately comes down to the select board. So, we've provided other options. We've discussed with them. We've provided also again, this is a select board decision, not ours. So I think that's more of a discussion to have tomorrow.
I guess the question goes back to the 60-day notice that you said that there needed to be a 60-day notice. And you're within the 60-day period now. So is that a locked-in notice time, or is that
that's through the
kind of deal with that?
That's from the state, and I don't want to put Will Moran, who's head of Vermont EMS. I don't want to put Will on the spot, but if there's Vermont EMS rules that we have to follow, and part of that procedure is you have to apply for a license in this district, which Dale has, which in that rule states that you have to post a public notice for 30 days of the area you're trying to get your license in. We had to do the same thing for our paramedic license, which we applied for back in August. We posted this notice in the paper that we waited the 30 days for folks to do the comment to the Vermont EMS. We got no comments. So Dale has to do the same thing with his ambulance service. So that's what I'm referring to as we have this time frame as to where he has to get his license to be able to provide the service in our district. So yes, there is a 60-day
And the license that was applied for in August is now okay, so that's because
No,
60 days has lapsed.
It's, as referred to in that letter, it's still being hung up at there's 13 ambulance districts within the state of Vermont. And the district 13 is for this area, Wyndham County, and part of this area. Currently, Chief Hazelton, who works at Rescue, is the chair of that board. I know all you folks have seen the letter on the social network and the paper that he came out and indicated that he will do whatever he can to stop Brattleboro Fire from getting this paramedic license, which is unfortunate. Whether we do the ambulance service July 1st or we stay first response, we got 2 paramedics on staff. What a better thing for the town to allow those 2 folks to be able to practice that skill that they've got for the citizens of Brattleboro. So that's part of the whole process. Dale has to do the same thing. He has to go in front of the EMS board. Once they sign off on it, it then goes to Wills Moran at the Vermont EMS office. He goes through, in that EMS rule, there's checkpoints, things that you have to do prior to us sending it to the district or to Vermont EMS that we have to check off that we've done. And that's what we have done. Dale has submitted his, we've submitted our license. Now we're in the waiting.
Well, hopefully we come out of the other side on this in a good shape.
I'm pretty confident we will.
We'll talk tomorrow night more, I guess.
Yep.
Thank you for doing this.
You're welcome. Anybody else got anything? I want to thank you again for coming. I know, hey, change is hard. It's hard for anybody, but I've said it in interviews, I've said it on TV, and I'll say it to you folks tonight. Yoshi's right, we don't have the transport experience, but I can guarantee you these folks, if you call them right now and you're having a cardiac arrest, you're going to get the best care that you ever had. And over the next few months, we'll become very proficient at transporting people to the hospital. And I can assure you, you're going to receive the same level of service. And like I said, you're going to get a better level of service. And please email me your questions. A lot of folks have emailed the select board. I've tried to answer all those questions. You're more than welcome to come in and talk to me anytime you want. I'll show you the equipment. I'll show you around. Answer whatever you folks need answered. But I want to assure you that it's my job as the fire chief to be sure that you're safe and protected. And life safety is the #1 reason we're here, and we'll do that. And again, thank you for coming tonight.